Welcome. Your mission, should you choose to accept, will be intervertebral disc disease. Please proceed with caution. Intervertebral disc disease, or codename Ivdd, is a disease that causes the discs in between the vertebrae of the spinal column to bulge or herniate over time. I will now quickly brief you on the normal vertebral column. The canine spinal column is made up of 30 main vertebrae that are divided up into 4 regions. The cervical vertebrae are in the neck. The thoracic vertebrae are the ones connected to the ribs. The lumbar vertebrae are in the lower back, and the sacral vertebrae are in the pelvic region. The intervertebral discs are located between the vertebrae. Their job is to cushion as well as help increase the flexibility. There are 2 main reasons that IVDD occurs. The first offender is genetics. Disproportionate breeds tend to be more prone. The second offender is injury sustained from things such as jumping from high places or from being overweight. A trained agent, such as yourself, should be able to spot the following symptoms with your eagle eyes: neck pain, as well as stiffness and hunched back with no interest in moving and crossing one or both legs to walk. There are numerous diagnostic tools for IVDD. The Wartenberg wheel rolls up and down the dog's spine while the vet looks for signs of pain or muscle flinching to identify the location of the affected disc. After narrowing down the field of range, you will then have orders to X-ray the vertebrae. X-rays are generally non-conclusive, but will give the doctor enough information to make the decision for surgery or more testing. Here, you can see the bulging disc. It's there, but not really as clear as some of our other options. The CT scan can be extremely valuable because you can obtain such a clear image of the disc itself. Here on the left, you see a normal canine vertebrae. You can clearly see the spinal cord surrounded by the bone. On the right, the cord isn't as clear because of this dog's herniated disc. MRIs tend to be the doctor's most commonly chosen diagnostic tool. This is the clearest picture that can be obtained without contrast. Here, you can see that these arrows are pointing to 3 ruptured discs in this dachshund's back. Your targets that you should be able to identify will be Shih Tzu, Lhasa Apso, Pekingese, Thorgy, Corgi, Cocker Spaniel, Parrot Poodle, Poodle, Bat Dog, Dachshunds, Basset Hound, and generally obese dogs. Once your target has been acquired and verified, next comes treatment. Treatment options include crate rest, steroids, acupuncture, as well as surgery where the surgeon removes the disc matter that is herniated out into the spinal canal. These treatments are most often used in combination. The goal of your mission is to have your target return to a happy, healthy canine, but the prognosis varies with each case depending on severity and location of the disc. If the canine presents walking, then there are better odds of the dog being able to return to walking. However, once the canine loses feeling in his legs, he may never walk again. But have no fear! Paralyzed dogs get super awesome wheelchairs that keep them moving and quite happy. As the agent technician, it is your job to keep the canine monitored and happy-ish while completing blood work and other tests. Don't forget that when the doctor asks for x-rays, that you collimate the affected area and surrounding vertebrae, or entire spine if the dog is small enough. This message will self-destruct in 3, 2, and 1. Oh, hey look, there are those references.